Potential Not Pathology, embracing creative and resourceful approaches to psychotherapy with author and therapist Dr. Paul J. Leslie.
Welcome to Potential Not Pathology, where we offer information and inspiration for mental health therapists who are interested in learning and applying unique therapeutic techniques and concepts into their work, with a focus on the potential each client brings to his or her therapy session. This program examines ideas and tools which can assist your clients on their journey toward healing. I'm Paul J. Leslie. I'm glad you're here. Welcome. Today I thought we would spend a little bit of time talking about mindset. Since this podcast is about unique ways of working with clients and discovering empowering ways to create changes for the positive in the field, I thought it'd be a great way to start out discussing getting what I call a potential not pathology mindset. I've come up with some, I guess we'll call them presuppositions about how the therapy world can work through my experience, limited experience compared to many, but I've had a good bit of interactions with people from many different walks of life in the therapy room. And I've kind of come to the conclusion that the mindset that we bring into our session as therapists might be the most crucial thing we can do to help our clients begin to change. If we get past the idea that it's the techniques that do it, it's the theories that do it, more and more research is coming out that techniques and theories are really secondary to the relationship between the therapist and the client. I believe then it's the mindset that we bring in that's just so crucial. So I've come up with a few presuppositions, if you will, about getting a potential not pathology mindset, a PNP mindset. I like an acronym, some acronyms sometimes. So this is the PNP mindset. When we sit down with a client, our beliefs and expectations are many times more important than the client's. Because if we approach therapy through a lens of limitation, of lack of inspiration, and we're expecting the client to supply that for the session, we get really disappointed a lot and frustrated a lot, and we start to see clients as being resistant and not interested in being motivated or doing the work. And in some cases, that's certainly true. But I think we need to ask ourselves, are we bringing into the session things that make the session come alive? Are we bringing things in to allow the client to know that they are in the right place and that healing and change can take place? And the only way to do that, no matter what technique you've got, no matter what theory you're using, starts in your mindset. So if you instantly get a client and they've already, maybe seen some other people, and you start going like, well, geez, I don't know if I can help this person. Already you're sabotaging yourself and you're sabotaging the client. It doesn't mean that you're going to, get a perfect score with every client. There's always going to be some that aren't a fit for you. But if you walk into a session with already this idea that, well, these type of clients are always difficult to treat, and you start forming these belief structures that limit the potential for change to happen. If we do that, we limit the client's potential to access their own inner resources to create change. So we have to be very clear, in my opinion, about our mindset about therapy. I've met many therapists, many well-meaning, wonderful people, and when I ask them what their mindset is in therapy, they just kind of look at me and they go, "Well, I try to be supportive, and I try to direct their thoughts." And I try to okay. Those are things, that's great. But what are you doing? For you. I mean, what's your mindset about this session? I mean, instead of getting locked into a idea that this is what's going to happen. What are your beliefs about the change process? So I'd like to start with the first on my list of potential not pathology mindset. Number one is every client is unique. Every client is unique. I think many of us get a pattern of seeing people as their symptoms. And then we start lumping those people into categories. So when somebody is experiencing depression, and a lot of times therapists will think of them as, oh, here's my depression client. Here's my anxiety client. Here's my borderline. Your 2 o'clock borderline's here, says the front desk or whatever. And what starts to happen is that we forget that, yes, the clients can be suffering from some of these symptoms, but even in these symptoms are the same for 2 different people. Each of those people is unique. And to think that each person is always going to respond the way that everyone else does is limited at best. And number 2, creates a potential for things to go awry when you want to use this technique that now they worked with other people. Why isn't it working with you? I guess you're resistant. Every client is unique. We put a lot of labels on people. We put a lot of labels on people, and we tell them that, we're going to diagnose you, and, well, I've diagnosed you as bipolar 2, or, your adjustment disorder with mixed, depressive episodes, or whatever. And even if we don't tell the client that, in our own mind, when we start labeling people, we fit them into these categories. And categories is a plural thing, not a single thing. When somebody is having a mental health issue, and we say, oh, well, treat them the same way as you did all the other people, we may be unduly creating a potential for this person to get stuck. Because when your set interventions don't work, they may believe that it's something about them. It's not your your ability as the therapist, because this has worked with other people. It must be them. So if you approached every client as this is the first time you've ever seen this person before, which, by the way, it is in your first session, even if they have these labels, the labels of depression, anxiety, generalized anxiety disorder, all this doesn't matter. If you go, this person is a totally unique human being, and I'm not going to jump in with any techniques or theories or anything to get them to mold to what I want them to be. I'm just going to see what comes up in the moment, instead of saying, okay, well, they're fitting into these categories of symptoms, so I'm going to treat them as the categories. Now, I'm not saying that you don't use effective techniques, or if there are theories of change that work for you, but you need to have a little ability to look at someone, the resources that they may have access to, as totally, it's okay to be different than somebody else. I've worked with this person in the past who's a very well-meaning therapist and a very nice person. And she told me that, she only did evidence-based therapy. She tended to like to stick with the evidence-based therapy. And yeah, that's fine. you know. And in our discussions, I was saying, well, what's the particular evidence base? And she likes a lot of the cognitive behavioral therapy, which is great stuff. But I was, I've been there, done that, and I was kind of like, I think you need to get more experiential along with the cognitions, because it's experience that really, changes the structuring of our brains more than just, here's some more information. But she's like, well, the evidence, I haven't seen a lot of evidence to support that, and it's all evidence based. And I said, okay, so you've got this client. Now, this client that's in front of you, you're going to use the evidence-based therapy with, and that's cool. But if you look at every research study done with that evidence-based, there's a small group of people that didn't get better. So what are you going to do for those people? She just kind of looked at me. And she's, well, I don't know. I mean, I can do what I can do, and if I can't do, then I guess I'd have to refer. And the whole time I'm hearing, this person did not fit into the category, and so therefore, I can't help them because I'm limited to one way of doing things because all the other clients, fit in that category. All I'm saying here, folks, is if you're going to approach every client as unique, you're not trying to get them to mold into any preconceived ideas of how they're supposed to respond. You're not getting them to get stuck in any type of technique that might have worked with other people. It's not working with them, so you don't keep doing the same technique. You have the ability to see that this person is bringing something totally unique to the table. And instead of trying to do a play-by-play with all these rigid ways of interacting with people with this as I said, this preconceived notion that this is the way it's supposed to be, we can end up frustrating ourselves, viewing clients as resistant, and just basically, I'm sorry, getting bored. I don't know about you, but if I have to do the same intervention over and over and over again, I start getting bored. And it's not because, it's not a good intervention, but I found that it just doesn't always work for everybody. But even if the intervention works, sometimes the way you administer it needs to be different. So if you have a Part A, Part B, Part C, and you're trying to fit them into this algorithmic scale, which, by the way, a certain person who I won't name is very well known, told me one time he came up with this algorithmic pattern for when clients come in, how to come up with solutions to the problem, and he wanted to fit people into this rigid mathematical formula. Well, I never was good at algebra anyway, because I used to kid with my parents. My grades weren't very good, that I missed the first day of class and never figured out what X was. So to me, 2 plus 2 will always equal 4. But your client sometimes comes in and 2 plus 2 may equal 5. So we need to treat them as unique individuals who aren't here to conform to our rigid patterns of interaction. Which leads me into mindset number 2, being flexible. We need to be flexible as therapists, not just in seeing our client as unique, but in our own behavior and in our own techniques. And what I mean by this is, when our behavior is very rigid, as in we're only going to respond one way, or maybe even 2 ways, we get limited outcomes. I really believe this. I think our behavior, rigid behavior limits our outcomes. So if every client is unique, that means that every client we need to be unique. we need to be utilizing what they're giving us. We need to be looking for those resources that they need. So if in order to activate the resources or help motivate them in a direction to do something to transform the quality of their lives, we need to do more than just the same old thing time after time after time after time. You ever thought about, I don't know, dancing for your client? Yeah, I said dancing for your client. Well, why would you dance for your client? I don't know. Maybe in that moment they needed you to dance for them. It might, for some reason, to kind of create some shift in the interaction, or giving them some ideas, or just breaking the tension, or maybe being so absurd that it causes them to adjust their limited patterns of interaction with you. What about you ever get angry with your client? Ooh, touchy. A lot of people are told you never get angry with a client. You just reflect back, and you just have this totally solid, not much emotion, and all this kind of blank slate stuff that the Freudians used to do. I find that there are times maybe you do need to get mad at your client. Not every time. Well, you get mad every time at your client. You need to get some help with that. But there may be a case you need to say, hey, look, I'm really mad with you. I can't believe this. So other times, you don't need to. What about crying with your client? Now here it gets a little tricky, doesn't it? Because if your client's really emotionally upset and they cry, which we see a lot of, if you instantly fall apart, you're sending the signal to them that, you might not be able to handle their emotions. But what if in some cases, and again, this is not all cases, but in some cases, an honest human expression of grief or sadness or tears of joy, what would that do in some sessions? Oh, it might transform the session. There's this wonderful story I read about Milton Erickson, the amazing psychiatrist and hypnotherapist. And this man had come to see Erickson, who had been in some kind of issue and resulted that he had a stroke. And so he had very limited mobility. And before he had the stroke, he was a very aggressive, successful businessman. And so now he was in this wheelchair, and his wife had to take care of him, and he could barely say one word. And so they came to see Erickson for help after he was released from the hospital. Well, Erickson, being the astute, brilliant psychiatrist that he was, he noticed that this is a man who, although couldn't talk, couldn't move much, at the moment, before he had the stroke, he was pretty aggressive. And not aggressive in a bad way, but he's a take charge guy. He was the guy who would take charge of situations within his company, and he liked to be in charge of everything, and very motivated and driven. And Erickson found out that in their interactions that the man had been very proud of his Prussian heritage. And as Erickson was doing his intake, he noticed that the man got very agitated because Erickson was taking very long with his intake. And if you know anything about Erickson, his intake would go on and on. He wanted every little detail. So Erickson noticed this, and he even began to slow down and ask questions very slowly, and even minute, simple questions became larger, more elaborate questions that took forever and ever. And so this man who had the stroke, he's just getting irritated. He kind of wanted Erickson to get on with it. Erickson saw this, and he noticed the guy was kind of fidgeting in his seat. He saw that he was actually moving a little bit because he was getting angry. Well, that's all Erickson needed to see, because Erickson then proceeded, after he was done with his intake, to insult the man. Started talking about the cowards in Prussia. and how Prussians weren't good for much of anything, and how the guy was lazy and how he's an embarrassment to his family, and just went on and on to the shock of this man and this man's wife. So after a good while of listening to this, Erickson looked at him. He said, "And I'm going to make you come back every week, and you're going to listen to me, and I'm going to talk to you, and I'm going to tell you what I think about you." And out of nowhere, this man, who could barely utter a word out loud, said, "No!" He somehow had found the anger, the strength, or something had wired his brain where that's all he could say, but he got that word out. And then he starts to try to get up out of the chair to leave. Now, he couldn't really walk, but he was trying to get out of the chair. So his wife eventually helped him out. And sure enough, every week they went back to Erickson. Erickson just constantly made this guy angry. He had the behavioral flexibility to create change in this person. By becoming a very kind of sadistic psychiatrist. Anyone who knew Erickson would talk about what a kind person he was. But he would just constantly get on this guy's case. Over time, the guy began speaking more. He began getting up out of his chair. He began walking. Anytime he came back in and he told Erickson, "Well, I walked down the block and back. It was hard, but I did it," Erickson would shake his head and say something derogatory about how pathetic that was. And, his wife must be ashamed of him. It sounds absolutely horrible, guys, but what I'm saying here is Erickson saw that anger was a resource. And he had the behavioral flexibility to know that he needed to adjust himself to bring forth that resource of anger. Toward the end of their time together, the man who'd had the stroke eventually was walking several miles a day. And last time he saw Erickson, as they were saying goodbye, he looked at Erickson and told him he loved him and that he was like a brother to him. Now, I don't know what that man's prognosis would have been with any other psychiatrist, but Milton Erickson had the flexibility in his own behavior to activate the resources inside this gentleman. Do you have the flexibility to allow yourself to become who you need to be in the moment? It's not being fake. It's just being actually genuine. If you're getting angry, maybe you need to say, "I'm getting angry." Maybe you need to be angry. Maybe you need to do something so out of the ordinary that it moves a client's interactive pattern of dysfunction, if we can call it that, into a new pattern. The same thing with techniques. Are you flexible enough with your techniques? If you only know one way to do a technique, you don't really know a technique. It's one thing I learned with hypnosis. When I started training in clinical hypnosis, you'd go to one camp and they'd go, "Well, this is the way you do it." And then you go to another camp and this is the way you do it. And you go to a third camp, that's the way. Everybody's got their way to do it. And that's why you want to learn from as many people as possible. But when you set that rigid, there's only one way to do it, I only do this technique this way, you're just kind of set yourself in stone. And then you cease being able to be flexible with each client, going back to number one, who is unique. So if you need to laugh a lot and joke and tease, you need to be flexible to do that. If you need to be quiet, reflective, peaceful, give off this aura of just total calm, then that's what you need to do. But if you can only respond one way, your success rate is probably not going to be very high as a therapist. So our second mindset is be flexible. Therapy is about you being flexible. If you're modeling to your client, wouldn't it be great to show them that they can be multiple ways by your actions, by watching you, rather than just one way, which is usually the reason they've come into therapy. They usually only have one way to respond to challenges in life. So life is absurd. Sometimes we may have to be a little absurd to create change in those people, to assist them by creating a shift in their thinking, in their actions, in their emotions, whatever we need to do. I don't think being passive ever gets you anywhere, unless you do need to be passive, because sometimes that's part of being flexible too. All right. Number 3 in our potential not pathology mindset. We need to focus on the client's resources. A lot of times we focus so much, as we kind of talked about in our last podcast, on the pathology, that we forget everybody has potential to be able to change, even if it's just 5%. Hopefully more, but even if it's just 5%, most people can change. You really believe that down inside yourself, or I think you wouldn't have started into the field of psychotherapy. So when we focus on client resources, what we mean is we're focusing on anything the client has that can help them grow, that could help them adjust patterns that are causing them disturbance in their life. Any value they hold, any behavior they're doing, any interaction with the environment, any spiritual beliefs, whatever they have, if we could focus our attention on that, we activate that resource, and that resource can flow down into other areas of the client's life. We think a lot of times that we're just compartmentalized. We think, well, if I have confidence in one area of my life, I can't possibly have it in another area. And what happens is, if you have confidence in one area of your life and you really tap into that confidence, over time, you'll find that can go into those other areas. If somebody has a certain value that they hold dear to them, and that value is important to them, if you can get them talking about that value, even just talking about that value is activating a resource inside themselves. Now, you could talk about the problem all day long, but the more you talk about the problem, it kind of solidifies the problem and their outlook on life. So after you've heard their story, you honor their story, why not just ask them about what resources they have? I mean, for example, I had a client a good while back who she was doing, I guess what's called cutting on her arm. She's a young lady, was doing cutting. And as a result of doing this cutting, it was making her feel actually more depressed than she was after she did the cutting. She would feel bad, cut to feel alive for a little bit, but then get more depressed because she was cutting. So she was kind of in this loop. Well, after learning about this and letting her process her feelings, I noticed on her arm that she cut in a way I'd never seen before. It's like very precise, so that the cuts could fit in certain angles. So it wasn't erratic cutting or anything like that. So I even brought it up. I said, it's like a part of you knows the best way visually, spatially to do this. Do you have a background in art or design or something like that? Well, that led to a conversation about her interest in graphic arts. And as a result of that conversation about graphic arts, we got her excited. I mean, we started talking about, graphic arts and about going to college, maybe going to an art school where you could major in graphic arts. And her assignments were to really spend her time focusing on collecting information about, colleges, whether in the area or outside the area, tuition, all these things, locations. And the next time I saw her, she was supposed to have all this information for me. So she left the office pretty excited. Well, when I saw her, it's either a week or 2 weeks later, can't remember how long, she had all the information, very excited. And here's the thing, she stated that her depression was a little bit better and that she hadn't cut. She hadn't had the urge to cut. She'd gotten so involved in looking at colleges and having the potential in her mind of something different in her future, it changed the pattern that she had. Now, if we'd stayed all day long on the problem, I pretty sure that that would not have been the outcome. It's only by looking at a resource. What was her resource? Art, her love of art, graphic art, design. Viewing her not as sick, not at all the pathology, but looking at the potential. What's that cutting telling us? So if we focus on a person's resources, we focus on their values, their identity, their behaviors, the environment they're in, their spirituality, whatever those things are, that's where the answers are. It's not in spending excessive investigation of somebody's pathology. So if our mindset is let's go in and look for client resources, you will find them. I have worked some pretty severe cases, and even in severe cases, I've found at least one resource. So they are there if we look for them. Number 4, in our last mindset, big thing for me, comes down to emphasis on results. If your mindset, your therapeutic mindset, is that you have an emphasis on results, automatically you're going to be more effective. And we think, well, certainly we got, treatment plans and treatment outcomes. And having said that, I know many therapists who are, creating great treatment plans and looking for treatment outcomes and measuring things, but it comes down to results. They get hung up still in their theories and their techniques, and it's got to come down to results. Are you getting results? And if you're not getting results, why aren't you getting results? And by the way, I mean positive results. I mean, you can get negative results, but that's probably not why people are coming to see you. So if you focus on the results, emphasis on the results, you might find after a session or two, nothing's going anywhere. Guess what? Change your approach. Change your approach. Do something different. Do something unexpected. Change up your pattern. Because if it's not working, instead of trying to, as we go back to number 1, thinking every client is supposed to fit into a certain box, they're not unique. We need to say they're unique. So I need to change and alter my approach. If I'm so focused on techniques and theories, and yet it comes down to, hey, it just ain't working, then I need, instead of labeling my client as resistant, as, not a good match, I need to, before I cut them loose and say, I'm just not the therapist for you. I believe that in our mindset, we need to say, okay, I need to do something. The therapist, needs to do something to begin to generate results. And if it means going back, 1, that we focus on client resources, going back to number 2, we become more flexible in our behavior and in our techniques, that's the route we need to take. So I'm not saying just, be only results focused, because a lot of people are like, well, we need to build the relationship and it's not about, the tactics. I'm not talking about that. Maybe the relationship is part of the result. Whatever your goal and the client's goal is, it needs to be clear. You need to know, where you're going. So if after 5 sessions, your depressed client has not even noticed 5% different, then you've got to do something different. You can't keep asking them to spot their irrational thoughts or to journal or whatever it is you're having them doing. And those could work great. I'm just using those off the top of my head. If that's what you're doing and it's not working, then do something radically different. Something radically different. Maybe you need to ask them to diagnose you. I mean, maybe you need to get them to, if they're going to journal, maybe instead of journaling focusing on all the bad things, maybe you need to get them to write about, things that could, never happen in their lives. So write for the next week. I want you to write every day about riding unicorns. I know I'm just making things up, but at the same time, this is serious business. And it's serious enough to not be serious. I know that's a paradox. But if you're so seriously stuck in only one way of doing therapy and it's not getting you the results, you've got to be so not serious about your techniques that you throw them away. and you just take the spontaneous moment that you and this person are having, this interchange between you and this person, and seeing what happens in the moment, and being able to be flexible, focus on the resource, and always know that they're a unique person and that no one that you're ever going to see is going to be like them. And that's how you start getting those results. So again, our potential not pathology mindset. Number one, every client is unique. Number two, become flexible. Being flexible in our behaviors and our thoughts and techniques. Number three, always focusing on client resources. Number four, our emphasis is always on results. Now, it doesn't matter what, if you're doing CBT, DBT, NLP, ACT, MOUSC, whatever your acronym is, Freudian, psychodynamic, Jungian, you can still adopt this mindset. This mindset is open for anybody to adopt. Try it if you're not already doing it. Again, if you're doing this, if I'm talking to you and, as we say, I'm preaching to the choir, high five, I'm glad to hear it, keep it up. But if not, try it. Go in tomorrow and just said, how can I make every client I see today unique? How flexible can I be in my behavior and technique? How can I shift the focus from client pathology to client resources? And how can I put an emphasis on getting consistent results? I hope it goes well for you. I found that when I made this shift in my mindset, I got a heck of a lot better. My clients got so much better, faster, and I didn't have as much burnout by being flexible and having all these kind of options in my mind, these possibilities. I didn't feel burned out like I used to when I kept trying to get people to fit into my idea of how they should fit in, which, by the way, is always a recipe for being frustrated. So anyway, I hope you got something out of these 4 ideas for your mindset. Play with them, these beliefs, these presuppositions, and I hope they bring you many wonderful, fruitful experiences. Really appreciate you listening today. Again, this is Paul J. Leslie, and thank you for listening, and I hope you have a fantastic rest of the day.
Thank you for listening to Potential Not Pathology with Dr. Paul J. Leslie. If you enjoyed the show, check out our website at potentialnotpathology.com, where you will find programs and articles showcasing unique and creative therapeutic applications.